Hello everyone, welcome to the new video. We will be today studying about wound healing. We will cover this topic from Bailey and Love of surgery. Definition: wound healing is a complex and dynamic biological process. All organ systems following injury result in fibrosis and scar formation. Fibrotic healing of the tissue causes tissue dysfunction. Now we will study about how normal wound healing takes place in the skin. Normal wound healing takes place in 4 stages. First is hemostasis, second one is inflammation, third is proliferation, fourth is remodeling phase. Hemostasis: injury leads to disruption of the vascular endothelium, which causes vasoconstriction and exposure of subendothelial extracellular matrix. This vasoconstriction and the exposure of the matrix encourages platelet to adhere, activate, and aggregate. This adhesion, activation, and aggregation results in the formation of platelet plug, which helps in limit the blood loss. Platelet activation results in activation and release of the granules. Alpha granules contain cytokines and growth factors. Example of growth factors are transforming growth factor beta, epidermal growth factor, platelet-derived growth factor, fibroblast growth factor, vascular endothelial growth factors. These all growth factors involved in deposition of extracellular matrix, chemotaxis, epithelialization, and angiogenesis. Platelet, when activated, leads to activation of platelet aggregation. Injury site releases tissue factors which initiate coagulation cascade, which result in thrombin formation. This thrombin formation produces fibrin, which stabilizes the platelet plug. Stage 2 is inflammation. Early inflammatory phase, which occurs for 1 or 2 days. In this phase, platelet activation causes influx of inflammatory cells. Polymorphonuclear leukocytes, mainly neutrophils. These minimizes the bacterial contamination of the wound. Local injured tissue and platelets releases vasoactive amines, which are histamine and serotonin. These histamine and serotonin increases vascular permeability, which aids in the infiltration of the inflammatory cells. Late inflammatory phase, which occurs for day 1 to 2. In this, there is the appearance of monocytes in the wound. These monocytes differentiated to form macrophages, which helps in wound healing. The function of macrophages are phagocytic cells, which phagocytose the debris, releases proteolytic enzymes, which debride the wound. And third one is primary producers of cytokines and growth factors. These cytokines and growth factors promote the fibroblast proliferation and angiogenesis. What is angiogenesis? It is the formation of new blood vessels. Inflammation phase or inflammation is characterized as rubor, means redness, tumor for swelling, calor for heat, and dolor for pain. Stage 3 is proliferation, which starts around day 3 and lasts for 2 to 4 weeks. This phase consists mainly of fibroblast activity with production of ground substance like glycosaminoglycans and proteoglycans. Second is collagens, third is angiogenesis and re-epithelialization of wound. Wound tissue produces during early part of this phase is called granulation tissue, which is pink in color and appears granular. Later part of proliferation phase causes increase in tensile strength of the wound, which is the result of increased collagen synthesis by fibroblast, which are mainly type 3 fibroblast. Some fibroblasts differentiate into myofibroblast, which are contractile cells. When these cells contract, they bring the edges of the wound together, which helps in the closing of the wound. Last phase is remodeling phase, which begins at 2 to 3 weeks after injury and lasts for a year or more. In remodeling phase, there is maturation of the collagen. Type 3 collagen fibers is replaced by type 1 collagen fibers Type 3 collagen fibers are more seen in proliferation phase, whereas type 1 collagen fibers are more seen in the remodeling phase. This type 1 collagen fibers are stronger fibers which have more cross linkage, more uniformly alignment, and more tensile strength. The tensile strength, we can see the maximum activity or maximum tensile strength at 12 weeks post injury. This replacement of type 3 collagen fibers to type 1 collagen fibers takes place until 4:1 ratio of the collagen fibers is re-established. When this equilibrium established, then the remodeling phase stops. Thank you for watching.